Hello, and welcome to Grade.com Talks With. Today, we're talking with Jo Catherine Quinn from Caritas of Austin, an organization whose mission is to prevent and end homelessness for people in Greater Austin. And if you're new to our podcast, please press subscribe button either on YouTube or your podcast app, because today we're going to learn about an organization that is aiming to make homelessness rare, brief, and non-recurring in Central Texas. Hello, Jo Catherine. Welcome to Grade.com Talks With. We're excited to have you here.
Great. Thank you. It's good to be a part of this.
Wonderful. Could you please describe Caritas of Austin for someone who is not familiar with your work?
Caritas of Austin started in Austin in 1964 and was started by a group of community leaders, community members who were concerned that there were not enough services to meet people's basic needs. So those are sort of the roots of the organization. And the strength of the organization is that over those 57 years, the organization has done a wonderful job of evolving and changing to meet emerging community needs, still based in that basic human needs arena. And we have recently, over the last 15 to 20 years, really embraced, as homelessness has really emerged, unfortunately, steadily across all cities in the country, Austin included. The organization has pivoted to engage homelessness from an evidence-based perspective so that we can be most effective in preventing and ending homelessness.
Mm-hmm. It's great to see that your organization was based by community members who came together and saw the issues that the community was facing, and they came together and brought the solution that has been ongoing for 60 years. The challenges might have changed, but the organization was on the front line in understanding the basic needs, as mentioned by you, of the community in Austin area, and still is going and making sure the issues that the community is facing is being addressed and being evidence. The solution is based on evidence. So it's great to see that. You mentioned that the homelessness has become a bigger issue, not only in Austin, but across United States. But could you please describe specifically in Austin how big of an issue is homelessness?
Yes, we know that according to the data that we collect, that on any given day, there are 3,100 people experiencing homelessness. Mm-hmm. A large percentage, probably a larger percentage than most cities, of our homeless population are actually unsheltered people experiencing homelessness unsheltered. They don't have any kind of shelter. They're literally living outside. Over the course of a year, we see about 10,000 households interact for some type of assistance within the homeless response system.
Mm. Yeah, the number might seem in percentage of the population of Austin small, but there's still, as mentioned by you, almost 10,000 individuals who face this issue, and this issue can create barriers in their lives and can create hardships. And we need to be there to support our community members, support the individuals who are struggling and experiencing the issue of homelessness, and providing shelter is very important. Mm-hmm. Could you please describe to us what are some challenges those individuals who are experiencing homelessness face?
So a lot of the challenges that people who are experiencing homelessness face, first is just the overall traumatic experience that homelessness is. Living on unsheltered and in a place where you can't adequately protect yourself and protect your belongings means that you live in a constant state of alert. I think we all know sort of that feeling, especially all of us having been through the pandemic now for over a year. that feeling of always being on alert, of keeping yourself safe, and the stress that produces. If you can imagine that living unsheltered in a city in particular, where you're around a lot of people and you're constantly interacting with the public, it is very stressful. It is very stressful. And it's a constant stress that you don't get a rest from. So that's a major challenge. And that creates issues. It creates vulnerability to mental health problems. And sometimes people who become homeless don't have a mental health diagnosis, but they develop one after being on the street and under that kind of stress. So that's a major challenge. And then just what people might can immediately see, which is food insecurity and not having the proper nutrition from day to day, hygiene. Those are all just, those basic needs going unmet are the major challenges. And then we know that across our country, the cost of housing is the primary barrier to people emerging from homelessness. It is very, very difficult for people to afford housing now. And that's the challenge that our system has in terms of ending people's homelessness permanently.
Mm-hmm. Yeah, whenever we might think of the challenges, we might think of the basic needs as mentioned by you, food insecurity and hygiene access. But in reality, the constant fear and the constant stress that individuals experiencing homelessness face is very unfortunate and very alarming. And that might lead to mental health issues, mental health problems. And the recovering from that can be not short, that the recovery process might be very, very long. So the effects of homelessness might be present even if the individuals emerge from homelessness. So it's very unfortunate to see that. And you mentioned that one of the reasons the homelessness, it's hard for individuals to emerge from homelessness is the lack of affordable housing. And what is in your city, Austin, what is municipality or officials are doing to support individuals emerging from homelessness to make sure there is access to affordable housing?
Yes, over the last couple of years, our municipality, in particular, the city of Austin, has really been focused on developing what we call permanent supportive housing, and that is deeply affordable housing that actually has on-site support services located at the property. And so the city has been looking at all different kinds of opportunities to increase our capacity for permanent supportive housing. We've identified that we need a first goal is to provide enough permanent supportive housing so that we can house the 3,000 people that are experiencing unsheltered homelessness over the next 3 years. We're going to do that in a variety of ways, just traditional construction. Our company actually is about to break ground on a permanent supportive housing property. Also, the city is looking to implement a strategy that's a little bit faster than that, meaning rehabbing some hotels and retrofitting them so that they can be utilized as permanent living facilities for people experiencing homelessness and produce this permanent supportive housing that is needed.
It's great to see that your organization is working closely with the municipality to address this issue. And so to make sure that all those, as mentioned by you, 3,000 individuals have access to shelter and affordable housing is more accessible for them. So you being in the front line, you being experts in the field, advising the government and working closely with them to address this issue and provide the solution is very, very important. As your
And I would just add to that, to remind folks that are listening, we are in Texas. And so, as you might imagine, the government doesn't do everything. Our government is very engaged, but I always like to remind people that this takes the entire community, and we have engaged our philanthropic and business community, and they are involved as well.
Yes, absolutely. So the effort comes from the government. The effort comes from the community. There is also some government help, but the leading initiative is done through activists and community organizations such as yours, bringing together all stakeholders and providing solutions. And housing is one of the areas that you're working, but as an organization, you have created an evidence-based solution that addresses many challenges that individuals experiencing homelessness face, and one of them is being having access to education and employment. Could you please describe your works in education and employment for us?
Yes. As I mentioned before, the real ethos of our organization at Caritas is to always evolve and change and embrace what's most effective. And while the organization started as a group of volunteers, the organization has recognized through the years the absolute necessity for utilizing social sciences and professionalizing the organization. And so we're no longer just a group of volunteers. We absolutely utilize volunteers, but for the actual tough work of one-on-one with our clients and with people to get them to emerge from homelessness, that is done by social workers and other social science professionals. And so we have a professional organization that has through the years studied and learned what actually works. And what we know works is to solve the housing, an individual's housing challenge first. So our immediate intervention is to get someone connected to permanent housing. We do that by supporting that housing on the front end and then working with people with these comprehensive services that you've mentioned. First, meeting their basic needs, making sure they have the right nutrition, they have the housing with all the utilities, beautiful, nice housing, not substandard housing. So folks are in safe, decent housing. They have their basic needs met. And then we continue to work with them along a continuum of stability. And a couple of those services that are very key is employment and education, which are some of the comprehensive services that we offer. As well, our case managers who work directly with our clients, connect them to other community resources that Caritas doesn't provide, but that are key to their well-being and them being able to reach their full potential. Whatever health care they need, we ensure that they are connected to the resources that can provide them the health care and address their education needs, whatever their needs are. We are very committed to working with each client as an individual or as an individual household, depending on if it's a single person or if it's a household with numerous members in the household. Each household has an individual plan for stability that they co-create with our social services professionals. So there's no one size fits all. It is very tailor-made for each household's needs.
Mm-hmm. What I really like about your approach in addressing the challenges your clients face, as mentioned by you, is providing a tailored approach, tailored solution for them. So each case has dedicated a person with social studies background, and can address their experience to meet the needs of the either individual or family. So the journey from homelessness to being self-sufficient becomes easier, faster, and more sustainable. As mentioned, your vision is to make sure the homelessness journey is brief, non-recurring. So, and that tailored solution and tailored approach can make that become true. So that's very important to highlight and realize. And one of the other programs that you run is Food Pantry. Could you please describe about your Food Pantry, how many meals you serve, and how many individuals go through your Food Pantry?
I don't have those numbers right in front of me, but all of our clients that we serve, and in 2020 we served 653 people in our housing programs, and all of them have access to that food pantry. So our food pantry is a wonderful way as well to engage the community, because groups love to put together food drives. And we are very fortunate that the vast majority of the food that we have in our food pantry is provided through these food drives. We do a really good job of getting the food that we actually need for our clients, rather than just what somebody wants to clean out of their pantry, which can be an issue sometime. But we do a good job of communicating our list of foods that we need the most. And the food pantry is just a very key resource for our clients to have nutritious food.
Yeah, it's great to see that 653 individuals have access to, as mentioned by you, a nutritious food, and that food comes through the efforts of the community, who know the challenges that individuals experiencing homelessness face, and they bring the food and they support the community. So all community coming together is a beautiful journey to see, and a journey to experience.
And I would add that the way we utilize our food pantry, the method we use with clients, is that our food pantry is sort of the starter place for them to get, and a place they can rely on for several months or maybe up to a year. It all depends on the household. But during that time that they are using our food pantry, the case manager and the client are working together to identify other ways that they will be able to get their food ongoing into the future, so that they aren't faced with depending only on our food pantry going forward, that they can access food in a more mainstream way.
Yeah, it's great to see that you are providing a temporary solution, but also you're addressing them, providing a tool for them so they can have access to sustainable food, mentioned in their journey of becoming self-sufficient. So it's great to see that.
Our goal for every client is that someday they don't need us anymore.
Yes, it's temporary, but the permanent solution is for them to become self-sufficient and have permanent housing and have a wonderful and great life, correct?
Absolutely. And the reality is that for folks who've been on the street, unfortunately, for a very, very long time, they will need us for a long time. And some may need us the rest of their lives. But that is certainly the small minority. Most people, once they are empowered with basic needs and their well-being is addressed, they are able to reach their full potential and completely reintegrate into the community.
Yeah, absolutely. When the basic needs, food, shelter, as well as the healthcare is provided and they feel safe, then they can focus, as mentioned by you, on other activities to realize their potential to the fullest and become the best versions of themselves. And the fact that Caritas of Austin is helping individuals in that journey is wonderful. And I applaud your organization for doing that. If someone would like to support Caritas of Austin, how can they do so?
They can go to our website. There is a donate button right there on the front page when it comes up. And that is the most effective way to help us is by giving us money. Mm-hmm. And I know that's oversimplified and often people don't want to hear that message, but it is the best way because then we have the money to hire the professionals that we need. I would say one of our biggest challenges is that the scale of our scale of operation does not meet the need, and we need to be able to serve more people. We have been supported in a way that over the last 3 years, we have every year scaled our the number of people. We've served more people year over the last 3 years. We want to keep doing that, but we want to make those jumps in numbers bigger than they are right now. So having the funds to do that is important. We also have an Amazon wish list that allows people to donate move-in kits, which are basic supplies that people need when they're moving from the streets into permanent housing. You know, they don't have sheets and towels and pots and pans and those kinds of things, and beds and all of the things necessary to start your new apartment. The Amazon wish list is a great way to give.
Mm-hmm. Wonderful. The link to the Caritas of Austin's website will be provided in the description. So you viewing and listening can go to the website, familiarize yourself with the wonderful work Jo Catherine and the team are doing and support their mission of preventing and ending homelessness in Greater Austin area. Thank you so much, Jo Catherine. It was wonderful to get to know you and very meaningful and impactful work your organization does.
Thank you. It's such a pleasure to visit with you today.
Thank you. For you listening, if you enjoyed this conversation, please press like and share button because this will show the YouTube and podcast algorithm that this conversation is important, that we need to make homelessness rare, brief, and non-recurring. Thank you and see you in the next episode.